Centers for Disease Control, the CDC, has changed the criteria for testing. This is huge. Check this out. Leave your comments, ding the bell, share it with your friends, and subscribe to our channel. Interesting news coming out of Brazil. Manaus is a city, it is the capital of Amazonia, if I'm pronouncing that right, which is the central part of Brazil, which encompasses much of the Amazon rainforest and jungle. And excuse me, and the Amazon River cutting through it. In fact, there are two rivers that merge in Manaus. And it's a city of about 2 million people. Manaus, you may recall, maybe 3-4 weeks ago, was the city where there were aerial photos of mass graves being dug. You know, giant, long trenches filled with white boxes, wood thrown together, coffins, essentially. And they just had a terrible, terrible death toll there. And the Washington Post is reporting that Manaus has seen a drop in hospitalizations. Now, what I find particularly fascinating about this is that there's a number of things that will lead to a drop in hospitalizations. Typically, a drop in hospitalizations would follow a drop in new cases by about 3-4 weeks. Well, it would follow a case new by 3 or 4 weeks, and it would follow by 4 or 5 weeks, events that might cause spreading. And if you look at the United States, what you see is, on a state-by-state basis or national, you'll see the same trend, is that when it gets widely publicized that there's a terrible crisis going on and the hospitals are overloaded. I mean, we saw this in New York and New Jersey and Connecticut back in the spring and early summer. We're seeing it now in Arizona and Texas and Florida. As the hospitals start crashing, as the local news starts reporting what's going on, at that point, people go, oh, wow, there's something serious going on here. And so they put on their masks and they start social distancing and they stop hanging out in bars and things like that. And surprise, surprise, a week or two later, the infection rate goes down, and a month or two later, the hospitalization and death rates go down. So that's the most likely explanation for what's happening in Manaus. And truth be told, it's happening all around the world, that hospitalization rates are going down after really bad things get well publicized. But Fox News picked up this story, and the headline is, "A drop in Brazilian coronavirus cases prompts herd immunity questions." In other words, hey, did Manaus just finally have enough people infected that nobody's getting sick anymore? Now, herd immunity, the normal assumption among epidemiologists is that herd immunity requires about 70% of the population to have been infected so that they're carrying antibodies. And at that point, when a virus tries to spread through a population, it hits so many roadblocks and all those people who have previously been infected that it doesn't, catch the steam necessary to continue being an epidemic, and it just eventually peters out. And they point out in the article that Manaus never got past 20%, but this is a growing meme on the right. It's not just Fox News, and the story of Manaus, actually, and I think it's probably because of this Fox News story. But, it's being echoed on Fox News, it's being echoed on right-wing talk radio, it's being echoed in right-wing media, that, hey, there's light at the end of the tunnel if you can just get enough people infected. Which may ultimately turn out to be the case, but in the process, you kill lots and lots of people. It's the most brutal way to deal with this virus. I mean, yeah, it's the way that we dealt with things back in the 1300s, but really now? Seriously? Well, apparently the White House and the CDC think, yeah, okay, that's cool. Because the CDC announced yesterday that they have changed their guidelines for when you can get a COVID test. Now, this is hugely consequential because some insurance companies are using these guidelines to determine when they do and don't pay for COVID tests. And we haven't heard the reports from the individual states where Medicaid is, states pay for part of Medicaid. And so I can't say with any certainty that they're going to be able to refuse payment for COVID tests based on this new CDC guideline. But the question is out there. I don't think anybody, frankly, knows the answer to that question right now. And when that came down, there were a lot of epidemiologists and people in the scientific community going, what? I mean, the CDC prior to this was saying, clearly, unambiguously, it's important to get tested. This is what their guidelines used to be. They said testing is recommended for all close contacts of persons infected with coronavirus, regardless of symptoms. The agency also specifically emphasizes the potential for asymptomatic and pre-symptomatic transmission as an important factor in the spread of the virus. Therefore, people should be tested. Testing is recommended for all close contacts of anybody who is known to have COVID. That was the official position of the CDC, and it makes perfect sense. Right? If you want to stop an epidemic or a pandemic, you have to stop it by testing and contact tracing. And if you don't do the testing, the contact tracing becomes impossible. But we now have been putting up with several months now. It's, I was going to say, years of the Trump administration, but it's been, 5-6 months now that Donald Trump has been saying out loud that, we have 5.5 million cases in the United States just because we have so much testing. If we had less testing, we wouldn't have as many cases. And actually, there's some truth to that, only it wouldn't be we wouldn't have the cases, it would be we wouldn't know about the cases, because about half the cases, generally speaking, are asymptomatic. They're people who never get really, really sick. We don't know why. It's one of the great questions. If we could figure out why, it would probably give us the biggest clue about what to do about this virus, and there's a bunch of people working on that very aggressively. And the rest of us need to avoid getting infected until we figure that out. I think, within a year or two, we'll have this thing nailed down. The science will be there. I'm very optimistic about it, particularly, and the thing that makes me the most optimistic is the fact that half of the people who get it don't get sick. But that said, that half of the people who get it and don't get sick, and that maybe 90% of kids who get it and don't get sick, are still capable of spreading it to those people who do get sick, those people who are who have a body mass index that I think it was over 27. I'm sorry, not an expert on body mass index, but those people who are obese, which is roughly 1/3 of the American population, regardless of age, even teenagers who are obese die from this. There seems to be a clear connection between obesity and deaths. We don't know exactly why. It doesn't appear to be purely a mechanical thing, like, the fat weighs down on the lungs or something like that. It appears to have something to do with our metabolism. But the CDC came out yesterday and said, if you've been exposed, you don't need a test. That's our official position going forward. And when they came out and said this, there were epidemiologists all over the country who were going, why would they say that? And now CNN is reporting, yes, the CDC, insiders inside the CDC are leaking that it was the White House who leaned on the Centers for Disease Control and said, change the rules so that fewer people will get tested. So that, so that part of it, by the way, this is from me, not from the people who are leaking. They're simply saying, yes, it was the White House who did this. But I'd say the obvious reason is so that if right now we're discovering 50,000 cases a day and 1,000 deaths a day, if right now we're discovering 50,000 cases a day and, a third or a half of those people are not symptomatic, if we stop testing people who aren't symptomatic, suddenly we're going to go to 25,000 cases a day. We're going to have numbers just like Manaus, Brazil. Oh my God, look at that. The problem's been solved just in time for the election. What do you think? Seems to me like this is just transparent.